Okay, I think we'll kick off this morning. So, morning everyone. You're very welcome to our webinar this morning. My name is Aisling Duffy and I am a Senior Project Manager with HSE Mental Health Operations Team. So that's the National Office for Mental Health within the HSE. So this webinar is for yourselves as nursing home staff, and it will focus on grief in nursing homes, particularly in relation to COVID-19 and that experience, and will also focus on some general supports available to you as staff. So this webinar is a result of a partnership between HSE Mental Health Operations and HSE Older Persons Services, alongside our great support with the Irish Hospice Foundation and HSE Health and Wellbeing. I'd like to mention Roisin Maguire and Jackie McCormack here this morning, who are joining us from Older Person Services, who have worked really hard with the national COVID response teams in older persons to bring this event about this morning. So I'm just going to go through some housekeeping this morning. So the webinar will be recorded. It'll be available afterwards if you would like to get it, or if you would like to pass it on to one of your colleagues, I will make it available afterwards. If you'd like to ask any questions or make any comments, you can do so through the chat box. I'll be keeping an eye on those, and if there's any comments or questions that we need to get through this morning, we'll raise those with our speakers. The webinar will run until approximately 12:30, so about an hour and a half from now. So we are aware that we have a mix of HSE and non-HSE staff with us today, and you're all very, very welcome. So just to note that there may be a small amount of resources that we mentioned today that are only available to HSE staff. So we'll make you aware of those as we go through the morning. Our first presenter this morning is Breffney McGuinness, and Breffney is a National Bereavement Development Specialist with Irish Hospice Foundation. And Breffney will focus on grief in the workplace for nursing home staff with a focus on COVID-19. Our second presenter is Sarah McCormack, who is a National Healthy Ireland lead within HSE Health and Wellbeing. And Sarah would describe supports available for nursing home staff, both within themselves and externally. So I'd like to welcome you both, Breffney and Sarah, this morning, and thank you for your time. I will now hand over to Roisin Maguire. Roisin is the General Manager for Older Persons Services. Hope you all enjoy the event this morning.
Thank you, Aisling. Good morning, everybody, and you're most welcome to this webinar on the impact of COVID-19 for managers and staff. And today's emphasis is particularly for staff in nursing homes. So that's yourselves, and you're all very welcome. As Aisling said, Jackie McCormack was on the call, and myself, we've worked with the National CRT Forum and colleagues in the National Office with the CRT leads, who you'll all be aware of and in contact with and working together with in responding to the various outbreaks and situations that have taken place as a result of COVID out in your units. So it's really nice for us, having had the contact with the leads on a very regular basis for the last 2 years in what are unprecedented circumstances, to now have an opportunity to focus with yourselves on what has happened for yourselves in your response to the pandemic. So I want to thank you all very, very much for your response. I want to acknowledge to you all of the work that you did, and it's work that was done in unprecedented circumstances. We never had a pandemic before, and if we think now back to the beginning of the pandemic, there was so much unknown and that we hadn't dealt with, and there were things we had no sense of how it was going to be or what was going to happen. Yet all of you and others who aren't on the call this morning, in very, very professional way, as we always do in health service and as you always do, put your shoulder to the wheel and you made your response. And I want to sincerely thank you on behalf of older people and managers and staff in older person services for doing that. So this morning then is for you, and it came as a result of a request through the leads on the National CRT Forum to have some time and have some input on what the impact was on yourselves, on staff and managers. So that's what we're doing today. It's our second seminar of 2, and the first one has gone very well, and we're going to, I suppose, add to this one in light of the learning from all of that. So I suppose, take your time now, try and leave the business outside the door and take some time, well-deserved time for yourselves. So I'll now hand over. If there are issues that come up in the chat box, we'll deal with them either today or otherwise we'll follow up afterwards if they need that additional follow-up from this morning's call. So that'll be done and we'll get back to you on that. It'll all be done through the CRT forum so you can link with your leads on that. So I'll now hand over to Breffney McGuinness. Thank you.
Thanks, Roisin, and good morning, everyone. You're very welcome and delighted to be with you here this morning. And as Roisin said, this is a session for you. We're going to be looking at grief and bereavement, and an area I suppose not often looked at, the impact on staff of bereavement that you may come across as part of your work, and certainly during the pandemic that was the case. I'm going to look at some things around that and how you can be supported and what can help in terms of looking after yourself, and also organizationally what can help. We're going to use the chat function quite a bit, and Aisling is going to help here. She's going to be monitoring the chat function. This is being recorded, but we're not going to use names, so and the chat will not be part of the recording. So anything you put into the chat will not be part of the recording. What I'm going to do, before we begin, is to tell you a little bit about myself. I work with the Irish Hospice Foundation. I work in the area of grief and bereavement, particularly in workplaces. And one of the main areas that I work on is the impact of grief on staff. That's grief that can arise in our personal lives, but also in our professional lives. What I'm going to be looking at this morning are a couple of areas. One, looking back over COVID and what COVID kind of added to the grief that we might have experienced and that you might have experienced. A little bit around the grieving process and how that works and what can be helpful for ourselves or for others when they're grieving. And a little bit around looking after yourself and how you take care of yourself, particularly around grief and loss and what can help around that. So that's the rough outline of what I'm going to be covering. Could I just ask you to have a quick think and maybe to pop into the chat box, and just remember this is not going to be part of the recording, so nobody else will see this going out, if you like, on the recording. But just think, what's one thing you'd like to get from this morning's session? So we're going for about an hour and a half. I'm doing the first more or less 50 minutes, and then Sarah is going to come in with the Healthy Ireland focus. So what would you like? What would be one thing that you would like to get from today's session? I just invite you to pop into the chat box there. One thing that you'd like to leave with from this session. What would be helpful for you? Remember, our topic is grief, and it's particularly the grief that you as nursing home staff may have experienced as part of COVID-19 and may indeed still be experiencing as part of COVID-19. So I'd invite you to just take a moment and use the chat function and just pop in there. Is there one thing that you would like to get from today's session? And Aisling's going to be monitoring that, and we'll come back to that from time to time. And so I'm going to begin here with presentation. And as I say, Aisling's going to be monitoring the chat function, and I would encourage you to use it. And just again, what are something that you would like to just help us shape the content from this morning? So I'm going to begin by looking at, the presentation, which I'm going to show you here. Great. Yeah, lovely. Just bear with me there a moment. The joys of online.
Looks good, Breffney.
Okay, great. Thank you, Aisling. Can you see okay there?
Yeah, all good.
Lovely, great stuff. So what we're looking at today, and the outline, as I said, of what I'm going to cover are a couple of areas: COVID-19 and the grieving process. We're then going to look at personal and professional grief in the workplace and what can help when you're grieving. And then how do we look after ourselves, the self-care piece. And I'm going to begin with COVID-19 and the grieving process. And I suppose it's good to stop, as Roisin mentioned, about the unprecedented, I suppose, events that have happened over the last over 2 years now and are still continuing around the COVID-19 pandemic. And just to stop for a moment and reflect just how many people have been impacted by this, how each of us have been impacted in different ways. And I have a picture here. This is of a picture of a church in Dundrum, in Ballally in Dundrum in Dublin. And what they did in this parish, when the first person died in Ireland from COVID-19, they made a small St. Bridget's cross and they put it on the outside of the door. And as the pandemic progressed, and more people died, they made a cross for each person and they added them to the door. But soon the door wasn't big enough to accommodate them all, so they added them to the outside wall, and then they had to extend that to their community centre and then extend that to the entrance to the church. And what you can see there, I know that the photograph is a little bit blurry, but what you see there, those little white bits, they are all St. Bridget's crosses, which represent a person in Ireland who died from COVID-19. And I suppose what it does is it gives us a sense of the enormity of what we are living through and the enormity of the number of people who are impacted. And these are just deaths from COVID-19. People also died from other illnesses during that 2-year period. So this is just a small subsection, but even there we get a sense of the enormity of it. And the young man that you see there with his bicycle looking at the wall, he is actually a Spanish national. His grandfather died in the first wave of COVID in Spain, but because of the restrictions, he couldn't get back to Spain for his grandfather's funeral. And he comes to this place to remember his grandfather. And I suppose what this provides us with is a link to the international nature of COVID. It cross borders, it cross continents, everybody has been affected by it. And I suppose it gives us a sense of just what it is that we have come through. And I know that you in your nursing homes will have, I suppose, experienced the sharp end of this. Again, as Roisin would have said, doing the, I suppose, the very difficult work that you had to do with many things changing all the time, and a lot of fear and a lot of concerns, and adjusting to that and trying to provide care to people in very difficult circumstances. Why I put this up here is I think to help us remember that an awful lot happened in the last 2 years, and it's good to be aware of that. And it's also wonderful that we're in a different place now and that we can enjoy things we couldn't enjoy. I mean, you just have to look at the airports now to see how many people are flying and getting a holiday, the first one they've had in 2 years. And that's brilliant. It's great that we can do that. But also not to forget the many people who've been impacted by COVID, and you yourself will have been impacted in different ways, whether that's through a death or whether it's through changes in your life circumstances or your work arrangements or your personal arrangements. And it's good to acknowledge for ourselves what it is that we have lived in, with, and through, and continue to live with. I'm going to show you a short video in a couple of moments, which looks at one man's experience of his mother who died in a nursing home during COVID-19. So just give you a heads up on that. He had a good experience with his mother, so that's good to know, but also just to be aware that it might bring you back in touch with some experiences yourself. So that's coming up soon. But just before that, I just want to look at a couple of the, I suppose, realities of grief during COVID-19 and some of the legacy that we have from it. There were challenges and also opportunities with which COVID brought. Some of the challenges, and you would know this very well yourselves, was the way that loved ones may have died. Less than ideal, less than what we would hope. And to remember that people were doing their best in very difficult circumstances. For loved ones, I suppose it's not being able to be present with their loved one when they were dying, or maybe they might have been in touch with their loved one through maybe an iPad or a phone or that. But what we know is that many people had very difficult experiences around their loved ones dying, and not through anybody's fault. That was largely just the way that the pandemic panned out, and we did the best we could at the time. But that doesn't also take away from the fact that some people may have had, I suppose, less than ideal ways of saying goodbye to their loved one or being with their loved one. Some people may not have been able to be present when their loved one died, or if they were present, they might have been wearing PPE. And that's a very different experience to being with our loved one when they're dying. My mum died in a nursing home many years ago. I was very lucky with myself and my two sisters that we were by her bedside when she died. And we had a vigil with her overnight as she was dying. It was tough, but it was really good to be able to do, and there was great freedom around it. Not, I suppose that wasn't available to many people during COVID, and we need to acknowledge that and be aware of that. Many people grieved alone. Sometimes your residents will have grieved alone. They may have grieved for the lack of contact with their loved ones, not being able to come in and see them, grieved for their own fellow residents who may have died, for staff members who may have been absent or impacted by COVID. And I suppose one of the other challenges is delayed grief, that piece where, we do what we do to get through the situation and we manage it as best we can. But sometimes only afterwards we get a chance to catch our breath and reflect and just think, oh my gosh, look at what I've come through. And we call that, can be delayed grief or post-COVID adjustment. There's some of the challenges, some of the opportunities, believe it or not, which COVID brought was more openness around death and grief and how they affect people. It's wonderful that we have this gathering here this morning to talk about and reflect on grief as it impacts on nursing home staff. That's a great development. And I think that's come about because of COVID and because of an understanding that, so many people died and all of us were affected in one way or another by COVID. And there's more openness, I think, to talking about that and talking about our mental health, talking about our own wellness and our workplace well-being. And those are very good things. There is also growth that we found after COVID, and that's not to dismiss or minimize any of the difficulties that people would have experienced. But interestingly, some of the research coming out of China, Italy, and Greece on the impact on nurses of nursing during COVID has shown that while many people have reported stresses, similar to what we would expect around the SARS epidemic, also, something that wasn't expected was an increase in compassion satisfaction. And that's basically where people had a more of a sense of their vocation, of the worthwhileness of their job. Even though people were dying, it was very difficult, and a sense of being valued. Teachers would also acknowledge this. Ironically, many people now have a greater appreciation for what teachers do after doing a bit of homeschooling. I have to admit, I'm a bit biased. My partner is a teacher, so I have good information on that side of it. But it is true, we have a greater appreciation for maybe some of the services that people do, even in supermarkets and that. There is and has been a greater sense of community. Hopefully that will stay. I don't know what your own experience of that was. I had a good experience where I live here in Dublin of a more awareness of our community and more awareness and reaching out of people to each other to support each other. So there's pluses and minuses, but it's good to recognize that COVID has changed things in terms of grief. So now I'm going to show you that video. What I'd like you to do is just have a look at this and just see what strikes you from a grief point of view about this video.
A Dublin man whose mother died from COVID-19 has thanked the staff at her nursing home for what he said was exemplary care. The Irish Hospice Foundation has recommended that anyone receiving end-of-life care should be allowed to have a loved one present before they die.
Dermot Sreenan lost his mother Bridget on Easter Saturday after she contracted COVID-19 at a nursing home in County Kildare. He was able to hold his mother's hand to say goodbye after being supplied with a visor and full protective clothing.
It's like being in full Breaking Bad costume with a visor, a welder's visor, and hairnets and galoshes and everything else. So it was very difficult. So I just held her hand and I just said that she'd been an amazing mother and that she touched many people's lives.
Bridget Sreenan was 88 years old and had a chronic underlying condition. She was being cared for at Craddock House Nursing Home in Naas.
When she got diagnosed, she said to me on Skype, she said, "I think this thing will finish me." And I said, "You just got to do the right thing and fight it," I said, "and do whatever the nurses ask you to do." And she did fight it, but she didn't, she didn't win. Well, I'm going to be eternally grateful to the care home for just the level of care that they gave to my mum. They're exceptional people.
Due to COVID-19 restrictions, Bridget's daughter Geraldine was unable to leave the US to attend her mother's funeral. Only 11 people were present for the 10-minute graveside service. Friends and family were instead asked to wear purple, Bridget's favourite colour.
My mum was
Sorry about that. I think my CPU has decided to
quite
get upset.
vivacious and really loved life and was always up for everything.
Dermot and his sister plan to celebrate their mother's life with a special mass on her anniversary next April. Sharon Gaffney, RTE News, Dublin.
Right, so I'm just going to come back now to the main forum here. And again, this just gives us a chance to catch up with any of the points in the chat box. What I'd like you to do really is just, what's your reaction to that? I suppose when you see that, you're seeing a relative who is bereaved. And again, just in terms of your own experience, what is one thing that stands out for you in that video from a grief point of view? And again, I just invite you to pop it into the chat box. And Aisling, you might come in there if there's anything that we have in the chat box from the first question.
Yeah, definitely. So I suppose there's some teams already emerging, and just around the support for staff when dealing with bereavement as a result of COVID. So obviously supporting family members, maybe making extra accommodations for people that have COVID, and just a supportive, someone mentioned have a supportive plan in place for myself and my colleagues as we support families grieving. So, that two pieces there. To have a normal culture around death and grieving, and this was interrupted by COVID-19 restrictions, and the interrupted grieving is, often has manifested then that healthcare workers are being blamed for things that were outside their control.
Mm-hmm.
And how can healthcare workers deal with this, and have coping mechanisms to deal with this?
Great, thanks Aisling, and thanks very much everyone for those comments. They're really helpful. So we're going to have a look at those two areas. So how do you support families? We'll do that maybe looking at Dermot's video there, and then we look a little bit on how do you support yourself as staff around this and have coping with this, and particularly that piece about being blamed for stuff that was outside of your control. So we'll have a little look at that as well. So thank you very much. If we go back to Dermot, and we've just seen Dermot there, what, if you like, strikes you from a grief point of view? Or let's maybe put it a bit simpler. If you were to support Dermot, if he was coming into your nursing home, what would you say to him? So what would you say to Dermot? And again, just use the chat box there. And if you notice, Dermot was quite open about his mum. He was talking about her. He was also talking very clear about the care that his mum got, and how good the staff were in the nursing home. But from a bereavement point of view, if you met him coming back into the nursing home, let's say he was collecting some stuff for his mum or something like that, what would you say to him? And just have a think about that and maybe pop it into the chat box there, and Aisling will keep an eye on it. One of the things I'd also like to point out in that video, there were two moments where Dermot got a bit upset. I don't know if anybody noticed those. The first one was where he began talking about his mum and saying that she'd been an amazing mother. And you could see he just got quite emotional there. And the second place was where he was talking about speaking with his mum on a Skype call. And you could see, just as he was saying that, his mum said to him, "I think this thing is going to finish me," i.e. COVID. And you could just see he was right back there in that moment with his mum, and he got very upset. They are what we call grief bursts. It's where you get a burst of grief coming at you. And it's like you can be talking away and suddenly you're back there and you tap into all of the different emotions and feelings that you have around that. Grief bursts are entirely normal. What you saw there with Dermot is entirely normal. And the other thing that I'd like to point out there, and what's really helpful, is how the interviewer responded to Dermot. Can anybody remember what she said to Dermot? So when Dermot was there and he was speaking about him, can you remember what she said to Dermot? That's a bit of a trick question. I'm sorry about this. You only got 2 minutes to look at the video. She actually said nothing. She just listened to Dermot. And when Dermot had his two grief bursts, i.e. when he was talking about his mum and he remembered that she'd been an amazing mother, and you could see that he welled up with emotion, what the interviewer did was what I would call really good bereavement care. She simply allowed Dermot to have his grief burst. She listened to him. She didn't interrupt. And she provided him with a safe space where he could talk about his mum. And then very soon after, Dermot self-regulated and came back out of that grief burst. And then a little bit later, he went in, he had another grief burst when he was talking to his mum on the Skype call. A lot of the good bereavement support for family members, and for colleagues and for people that we know, is what you saw there. The ability to listen, to acknowledge what has happened. So acknowledging that Dermot's mum has died, to acknowledge that Dermot may be having those feelings, he may be having grief bursts, that's entirely normal, to validate those feelings and to support him. And we support people by our presence, by listening to them, and by being able to be present to them. It's not rocket science. And sometimes we feel uncomfortable around that. Don't beat yourself up if you feel uncomfortable around grief. Most of us do. But don't let that stop you from reaching out to a family member, to engaging with them, and to just allowing them to tell a little bit of their story. Okay, so I'm going to hop back here when I can find where my thing is. Okay. Go. So just looking a little bit more at the grieving process, what are some of the things that we would keep an eye on? One way of understanding your own grief and understanding the grief of others is to understand the significance of the loss to the person, or the significance of the loss to you. So that's that bit of, it's going to be different for different people. And even, let's say, a resident dying in your nursing home, that's going to be experienced differently by different staff members. And some people may be quite affected and other people may not be so affected. That doesn't matter. You got to deal with what you're dealing with. And that's the important bit. That's where you start. I'm going to have a look a little bit more around what grief is in another small video I'm going to show you, but just some key points around it. Grief is normal. It's not an illness. It's not a sickness. It's not something to be fixed. So we're going to have a look at another video now, and this one is about the grieving process. And again, what I'd like you to have a look at here is just look at it, see if there's anything strike you in terms of your own experience or something that might be helpful for you.
Loss is losing something that is of significance to us. For most of us, our greatest loss will be the death of a loved one, and we will mourn that loss most of all. Donal lost his mother recently. As she was dying, he was able to be with her, hold her hand, and say goodbye. He told her that she'd been an amazing mum, and had touched many people's lives. Grief is like a roller coaster. It turns your world upside down. It affects all aspects of your life and involves mental, physical, emotional, and spiritual suffering resulting from loss. It is not an illness or something to be fixed, but rather a natural process of reaction and adjustment to loss and change. This adjustment involves moving back and forth between loss coping, focusing on who we have lost, and restoration coping, adjusting to life without them. It is normal to experience a range of feelings when we are grieving. Some, like sadness and loneliness, might be expected, but others, like anger, rage, and guilt, may be more difficult to accept. The aim of our grieving is to help us adjust to changes in our lives. It is not to forget about who or what we have lost, but to learn to live with those losses in our lives. It's natural to have an uneven journey with grief. Grief comes and goes like waves. There are going to be peaks and troughs, and they don't always happen in predictable ways. Some months after his mum's death, Donal hears a song his mum loved and is overcome with a wave of grief. He hangs in there and gradually the pain subsides. Remember that during loss coping, we need to be able to focus on loss and whatever feelings we experience around it, including sadness, guilt, anger, etc. But we also need to spend time on restoration coping, adjusting to life without the person who has died. Where people run into difficulties or where grief gets complicated or is stuck is when the process of moving between these two types of coping breaks down. People can get stuck on either loss coping or restoration coping. If someone gets stuck on loss coping, all they can do is think about the loss and the person who has died. They can find it difficult to get on with other things they need to do in their life. But equally difficult is where people get stuck on restoration coping and think, this has happened, I have to cut that person out of my life and forget about them, sell the house, clear out all the clothes, get rid of everything. Good bereavement care involves enabling the movement between loss coping and restoration coping. People need to do both to grieve well.
So just going to pop back here and again invite Aisling if there's any updates we have there. Aisling, anything you want to come in on there?
Yeah, thanks, Bethany. And I suppose someone's making a very valid point there that while Dermot did get to visit his mum at the end of her life, you know, a lot of the other pieces which would happen in a normal circumstances when someone passed away didn't happen. You know, he would have, in normal circumstances, he would have been able to have lengthy chats with staff and with his mum. And also around the funeral service, that this would have been quite different in these circumstances. So just that this person is, I suppose, pointing out that Dermot might need some more additional opportunities to have support and to work through all of that. So really important point, just I suppose on the different ways that we had to cope during COVID with death.
Yeah, that's really an excellent point. And I think the piece you're saying there, Aisling, as well, about maybe the opportunities to talk to staff. I know when my mum died in a nursing home, it was well before COVID, but it was really valuable being able to talk to staff afterwards about her and to know how she was and how they viewed her. I found that very comforting. So I think it's an excellent point that person makes. Just to open it out to everyone there who's seen that video, was there anything that struck you? So what that video is talking about in the grieving process were the two types of coping, loss coping and restoration coping. But just was there anything that struck you about grieving and that explanatory video that stays with you? So again, was there anything that struck you? And again, I just invite you to pop that into the chat box. And again, it's just what strikes you, what impacts you from what you've seen there. One of the things that's really important, I think, around this is that we move over and back between loss coping and restoration coping. And in terms of the question that somebody asked about how do I support or have support for myself or a plan for myself in my nursing home or for my colleagues as well, we need to be able to do both of those things in our nursing homes. We need to be able to touch into the grief of staff around somebody who's died. And we need to be able to also look at the restoration coping. How do we adjust after this person's death? And it's not one or the other, it's both, and we move back and forwards between the two. So creating an atmosphere in my nursing home where we as staff can talk about the impact on us of a resident who dies, or indeed, as somebody has pointed out, where maybe the normal ways that we would have supported families and residents, we couldn't do that. They couldn't talk to us. We couldn't talk to them. We couldn't meet with them. So being open about the impact that has on you, and there may be things that can be done about that in the future. For example, memorial services or different kinds of ways of remembering who has died. And one thing to remember there, it's never too late to acknowledge what has happened, if that's a death, or to engage with the family. As you see behind me here, we set up a bereavement support line with the help of the HSE during COVID-19. One of the things that came out and comes out repeatedly on this line is people who come on who are bereaved, and the thing they find most difficult, believe it or not, is that people avoid them. It's not that people say stuff that upsets them, because the fact that their loved one has died is what upsets them. What they find most difficult is that people avoid them, or they won't bring up the subject, or they won't talk to them about it. And that's very isolating. So again, for your own relationships with families, and maybe their families, loved ones who died during COVID or during that 2-year period, it's always good to keep in contact and to engage with them, even if it's a way of saying, look, we weren't able to do what we would like to have done, but we want to remember your mum or your dad or your brother or whoever it is. It's also good for staff as well to be able to acknowledge what that was like, because we have to remember that staff can develop very significant relationships with residents. And you're bound to experience that loss when a resident dies. And you have different relationship with different residents, not the same for everyone. But that's not to dismiss that you may be affected by the death of a resident. And I know when my own mum died, this was pre-COVID, and when I did go to her nursing home to collect her belongings the day after her death, it was an awful wet day. It was miserable. And I remember going to the nursing home entrance, and there was a young healthcare assistant there, and she was waiting for me. And she had a tear in her eye. And she said, I just wanted to say to you, I'm very sorry about your mom's death. She was a lovely woman, and we'll miss her. And that made that day for me so much easier. And it was the fact that somebody cared about my mom, and the fact that I could see from her expression, she was holding back the tears, and I was holding back the tears as well. But you know something, her humanity touched me, and it made such a difference to know that my mom mattered in that nursing home. And I suppose that's something that I'm sure a lot of you do already. But it's really good to think about that. That's what families want to hear. They want to hear about their mum. You can't change the fact that the person is dead, but we can change how we experience that. And that can be very important. And it's good as well for staff to be able to acknowledge their feelings around what has happened, and that's not seen as being unprofessional or not coping or not being good at your job. If you were to ask me, did I think that healthcare worker was unprofessional? Absolutely not. I thought she was being really professional because she was being human first, and she was being a healthcare worker second. And that's what we want. That's what families want from us. That's what anybody wants from us when we're grieving, is humanity to humanity. So again, just being aware of both the impact on families, but also the impact on ourselves. Okay, going to hop back here. Continue on there. When it decides to behave itself. Oh, on you go. Just to say that not everybody grieves in the same way. And again, this will be true of you as a healthcare worker and also of family members. And you know, if I was to say to you, like, do you men and women grieve the same way? Just have a think about what your answer would be. You don't have to pop it in the chat box, but just have a think about what you'd say. Do men and women grieve the same way? What's your gut reaction? Most people say no. And in fact, what we know is that there are different styles of grieving, and two styles that are very clear are what we call an intuitive style of grieving and an instrumental style of grieving. And they're like two ends of a spectrum. And if we take the intuitive style of grieving first, this is generally associated with the feminine, with women. And that is, they feel their grief and they experience the grief, as does the instrumental griever, in the same way, but they process their grief in a different way. So an intuitive griever processes their grief by a need and desire to talk about and express their feelings openly. So if I'm an intuitive griever, my way of processing my grief is to feel my grief and to express that openly and to talk about it. And on the other end of the spectrum, we have what we call the instrumental griever, which is generally associated with men. Or the masculine. And an instrumental griever also feels the grief in the same way, but the way they process it is different. An instrumental griever is, as the name suggests, an instrument in the world. So I process my grief through doing, through problem solving, through activity or work. That is my normal way of processing grief. And for me, I don't seek out others with whom to talk about or express my grief. I do it, I figure it out myself, and I might touch in a little bit or check in with somebody, but basically I do it myself. And it's like you have two ends of a spectrum, intuitive on one end, instrumental on the other, and then what we call blended, which is most of us, which is a mixture of the two, but generally with one style dominating. What this means is that different people in your staff and different people in families will react differently around the same loss. And what you may find with one person who has an instrumental style, they may not want to engage in conversation about what's happened. We saw Dermot there in the video. Dermot was more of an intuitive griever. He was happy to talk about his mum. He was open about how impacted he was. He talked about what a great woman she was. But somebody else who's an instrumental griever may not want to do that. So I suppose the helpful bit for you is people have different styles of grieving. One style is not better than the other. So the goal of grieving isn't to get everybody to sit down in a group and talk about their feelings. That just would be very difficult for somebody who's an instrumental griever. Neither is the goal of grieving to just get on with things and just do stuff and keep working and keep going. What we need, a bit like what we saw in the video on the grieving process, is the ability to move into and out of those two types of coping. So the takeaway from this piece is people are different. People have different grieving styles. And again, you're not meant to be inspired to know what somebody's style is, but what we can always do is ask. And that's that bit of saying, if somebody is grieving, if it's a family member, if it's a colleague in work, how do you cope with things normally? Or how could I support you best? Can you let me know what would help? And what you're doing there is you're giving the person who is grieving the option to come back to you with what would be helpful for them, and just be open to the fact that it might surprise you what they come back with. So for example, if I talk to an instrumental griever and say, look, how can I support you best? They might come back to me and say, do you know what? I don't really want to talk about the grief today, but I'd love to go for a walk and talk about the football or something like that. If I speak to an intuitive griever and I say the same thing, and they say, do you know, I'm really glad you asked. I really miss my dad or my mum, and I'm just finding it hard at the moment. They're both equally valid responses. All we need to do is be open to different responses coming. And the big thing that we do need to do is to ask the person, is to reach out to the person who's bereaved, whether that's a staff member, whether that's a family member, whether it's a friend or a colleague. It's to reach out, to not let our own discomfort around grief. And to be fair, we all feel a bit uncomfortable around grief. I do. I work in this area. I still feel uncomfortable around it. But not to let that stop us from reaching out and engaging with people around their grief. And just another piece here around the goals of grieving. What are we trying to aim at when we're looking at the grieving process? And I love this image of the jars, and it presents two different ways of approaching the goals of grieving. And I'll talk to the first one, which is called shrinking grief, and that's the upper set of jars. If you think of the jar as being you, the person who's experienced the loss or the death of somebody close to you, the black ball inside the jar is the grief that you feel. And if we look at the jar that's on the left at the top, we can see that at the time of the death, the black ball fills the jar. And if we look at the second jar after that, the middle jar, we can see that the black ball has gotten a bit smaller. This maybe is a year after the death. And then if we look at the third jar, which is maybe 2 years after the death, we can see that the grief ball has got even smaller. And the idea of this shrinking grief approach is that it's a bit like a cancer tumor. You just shrink it, shrink it, shrink it, and eventually you hardly feel it. But a lot of people found that that didn't match with their experience of grief. And a more helpful way of thinking about the goals of grieving is the bottom set of jars, which we call growing your world. And again, if we look at the bottom set of jars, the jar on the left, and again, the glass jar is the person, you, and the black ball is the grief. And if you can see the jar on the left, on the bottom, you can see that the black ball fills the jar. And then if we look at the second jar, the middle jar on the bottom, and this is maybe a year on, and look at what's happening here. The black ball stays the same size, but something different is going on. The jar that is you, your world, your experience, is expanding around the grief. And then as we go on to the third jar, which is maybe 2 years after the death, a similar thing. The black ball stays with you, but your life expands around your grief. Your life grows around your grief. And I think that's a more helpful way of thinking of what are we trying to aim at with people when we're supporting families, when we're supporting staff. It's really not about getting over grief. It's about learning to live with grief in our life, but not just learning to survive. It's learning to thrive around our grief. And that our world expands if we're supported and if we're open to it. So that's a little bit around the goals of grieving and the grieving process. What I want to have a look at now is the idea of personal and professional grief. What do we mean by that? And this is from an article by Rabo et al. It's 2021. And it talks about healthcare workers as being witnesses and victims both. And that's grief in the time of COVID-19. And I'll just read a couple of pieces from this article. It says that healthcare workers recognize their responsibility to support the bereaved loved ones of our patients, but we must also attend to our own professional and personal grief in the COVID-19 pandemic. In the intensity and pervasiveness of COVID-19, healthcare workers' fears for themselves, their colleagues, and their own loved ones are often in conflict with professional commitments. Our healthcare systems have a primary responsibility both to prepare healthcare workers and to support them in their anticipatory and realised grief. Special attention must be paid to our healthcare worker trainees who may have not yet developed personal or professional grief management strategies and are coming into healthcare practice during a time of great disruption to both teaching and clinical care. And what Rabo is saying is there, look, we need to recognize the impact on you as healthcare workers of the situations that you've been in over the last 2 years, whether that's personally in your own personal life or professionally, deaths and losses that have occurred because of the work that you do. And so, for example, if you work in a bank, you wouldn't have been coming across the level of death and grief and loss that you did in nursing homes during the COVID-19 pandemic. And that's the difference between the work that you do and the work that other people do. So again, I'm going to show you a short video. And again, just have a look and see what strikes you on this.
Grief in the nursing home. There are 2 types of grief that are relevant for staff working in a nursing home. There is the personal grief of a staff member that arises from the loss of a loved one outside of the workplace. Then there is professional grief, which can arise as part of the employee's work in the nursing home. For example, when a resident in a nursing home dies. An employee may care for residents for a long time, sometimes years, and can develop strong bonds with them. They may spend more time with the resident than family members do. Healthcare staff in nursing homes can have a variety of reactions when a resident dies, which can include grief. Yet, family members are often seen as being the main grievers. And this is right, but the grief of staff can sometimes be minimised or discounted. A healthy workplace will recognise that employees need to be supported by their organisation around any grief. but particularly where the grief arises as part of working in a nursing home.
So again, just to give you a moment to think about that, what strikes you about that? Does that make sense to you? And again, I invite you to just pop into the chat box, if you like, any comments that you have on that, and Aisling will pick up on those. So just to have a look then, excuse me, at what can help when you are grieving. A couple of things can help. Firstly, if you're a healthcare worker, to allow yourself to grieve. That means recognizing and honoring our own grief as healthcare worker. Expressing your grief in your own way. So we looked at those two styles, the intuitive style of grieving or the instrumental style. And like what we would say is to look at how you cope and to honor that and support that. And if somebody's trying to help you, ask them to help you in the way that you normally cope with grieving, with your grieving style. Very important to take care of yourself. And I know Sarah's going to be talking a little bit about this in terms of ways that we can look after our health and other aspects. Very important that we look after our mental health and our well-being around grief. Taking care of ourselves, simple things like good diet, getting exercise, getting sleep, reaching out to others, not being isolated, and also looking out for our colleagues. That can really help when we're grieving, and particularly in the nursing home setting where you've had unique experiences as colleagues, which are shared experiences that people outside of your work environment may not fully understand. That last point, seek support and avoid isolation, that also helps when we're grieving. And again, part of what we're looking at here is developing healthy workplaces around grief, where it's okay to acknowledge that we experience grief. And that's seen as being professional. And, you know, the acknowledgement by our colleagues, by our peers, by our managers, by our organization, that goes a long way to helping people cope with grief. The difficulties arise when we don't do that, or when we block it, or we shut it down. So what's a way that we can do this? What's a way that I can help myself or help others? We have a 3-step process, which is called Bereavement First Aid. And 3 simple steps: AVS, acknowledge, validate, support. Acknowledge, if it's personally myself, acknowledge that I am experiencing grief, validating my own grief feelings, that it's okay, a bit as we saw in that little video, like some of the emotions we feel around grief can be quite confusing. We might feel anger, we might feel guilt, we might feel rage, we might feel sadness, we might feel emptiness, we mightn't feel nothing at all. It doesn't matter. The important bit is to validate my feelings. As we saw with Dermot, we could see that he got very upset when talking about his mum. Good bereavement care and bereavement first aid is not about shutting him down. It's about validating those feelings and supporting the person. So if it's me and if I'm the one grieving, it's seeking support, supporting myself, absolutely, but also seeking support from others and signposting to where there may be more help if I need that. So 3 simple steps, whether it's me that's grieving or whether it's I'm supporting a family member or somebody else. AVS, acknowledge the loss, acknowledge what has happened, validate the person's grief feelings, support them, and signpost. How do we acknowledge something very simple and genuine, which reflects how you feel? What I would say is don't beat yourself up about trying to find perfect words. The perfect thing would be if the loved one hadn't died. But that has happened. So what we're looking at doing is just communicating our humanity, our solidarity, and our support to the person. Think of what you'd say to your son, your daughter, a friend, or you know, a loved one. It's very similar. Look, I'm very sorry about your mom. Sometimes we don't know what to say, and it's okay to say, I don't know what to say, but I want you to know that I support you and that I'm here for you. More important than your words are your concern and compassion. Validation, very simple. And again, don't get too hung up on getting the right words. Trust yourself, trust your gut. This is really about saying, look, this is normal. It's normal to feel a range of feelings when we're grieving. It's going to take time to adjust. That's fair. It's not like saying to somebody, look, you'll feel better tomorrow. We don't know if they're going to feel better, they might feel worse. But what we can say is it's going to take time to adjust. Or I understand this is a difficult time for you. We're just reflecting back what we're seeing. And again, the big thing here is not to try and rush away too quickly from grief or try and sweep it under the carpet. That doesn't help in the long run. What people really want is to be acknowledged and for their feelings to be validated. We don't have to fix them. We can't change the situation, but you'd be amazed at the difference that having our experience validated can make for people. Support, what kind of support can we offer? Different support, just being yourself. Most people who are grieving, around 2/3, don't need counselling or therapy. What they do need is support from their colleagues and the support of a listening ear. Again, those 3 steps: acknowledgement, validation, support. We have a bereavement support line. That's the number there. If you're unsure, if you need help yourself, or if you're unsure how to handle a situation, very experienced people on that line. Give them a jingle, they ring you back, they'll talk through the situation with you. In terms of support for you, the Irish Hospice Foundation has developed a free e-learning course for staff on coping with grief in the nursing home workplace. Look, this is a short introductory piece, but it gives you some background on how to approach your own grief and professional grief if that arises, and also some hints around supporting others. That's free. That link will go out with Aisling in the follow-up to you. You can access it. It's free. Just fire away and use it. It's not going to cure everything, but it's a good starting point. And what you can do with this as well is maybe you could do it as a study group of staff, just play the video, ask people to come back and see what they thought about it, and use it as a discussion or a kind of professional development piece. What it does is it'll give some language and framework for thinking and talking about grief in the nursing home workplace. We also provide support for nursing homes. We have a Grief in the Workplace program, which involves a suite of resources and other things that we do in terms of training for managers and for nursing homes. And that's the link for that, and which will also go out in the slides which Aisling will send to you. So I'm going to come to the last piece, which is on self-care when grieving. And I'm just going to spend a couple of moments on this, and then we'll stop for any questions. The basic piece here is it's really good to look after yourself anyway as a healthcare worker, especially around grief. And again, we've an ABC on this. Acknowledging that grieving is hard when you're a healthcare worker, because sometimes, as we saw in the video, the grief of healthcare staff can be minimized or discounted. So acknowledging that that can be hard. B is for balance in your life. So processing your grief if grief comes up in your work, but also doing your job. And it's not one or the other, it's both together. Other thing that's really good in terms of self-care is fun, exercise, other interests. Sarah's going to touch in a bit on this. It's having that other piece to our life that the work that you do is very valuable. It's really important, but it's also demanding, and we need a balance to that. Creativity is a great balance to grief and death. Some people like gardening, some people like dancing, some people like walking in nature. It doesn't really matter what it is, so long as it nourishes you and it builds you up. And what I would say is do more of that. Containment is the C bit, self-reflection, and that's rituals and practice for letting go. You can do that as a staff group in a nursing home. It's remembering the people who have died, discussing that as a staff group, and then giving some time for that, and then being able to go back to other things. The danger is when we ignore this stuff, or we say, look, we just get on, it's not that important. That's where we run into difficulties. But creating space for it and sharing it among staff, because you might be surprised at what other staff might be feeling around the same death. We've done work with many nursing homes where, again, once we opened the discussion around how people may have been impacted by a death, people are genuinely surprised, staff are genuinely surprised to hear that other people are impacted by the death in a different way, or they have different memories of how that person died, or good memories. And that also helps to lighten the load so that you as a staff member are not carrying that on your own. Finally, in terms of self-care, I love this image of a boat, and it's from Trevor Powell's Mental Health Handbook. The idea is that you're a wonderful boat and we want to keep you afloat. And if you look at the boat, you're the boat and there's different sections to your boat. And you'll see there that work is one part of your boat, but there are many other parts: friends, children, partner, hobbies, indoor hobbies, outdoor hobbies, physical exercise, pets. Have a look at your boat. How does your boat feel at the moment? Is it well balanced and are you moving along nicely? And brilliant if you are. And if you're not, are there things you could do to adjust in your boat that would balance it a bit better? And what I would say is we need to be proactive around our self-care. We need to make it a priority for us. A good colleague of mine said to me, we've no right to offer care to others if we can't care for ourselves. And it's so true. Put a bit of time and effort into your self-care and watch what happens. You feel better, and the people around you feel better because you feel better. What I would say is the work you do is tremendously important. We owe you a debt of gratitude for the work you've done over the last 2.5 years. It's been demanding. You need to care for yourself, and you need to make a priority of that for you. And what I would say is put stuff into your diary that is just for you, that is nourishing for you, that takes care of you, that gives you some more fuel in your tank so that you have something to offer to others. So just in summary, loss and grief are normal in the workplace, in the nursing home workplace. We looked at grieving as a process and the idea of grief bursts. We looked at the idea of personal grief and professional grief. It's important to reach out for support and to support colleagues around grief. And self-care is very important when we're grieving. So I'm just going to stop there and I'm going to hop back and just check in with Aisling there and see how we're doing, Aisling, in terms of any questions or things we want to catch up on there.
Thanks, Bethany. I suppose it covered an awful lot of it, maybe the comments, but in your presentation there. But just something that someone brought up there was kind of, as workers, we, knew what to do maybe with a client and their family when they lost, a loved one during COVID-19. But for ourselves, for our own personal grief, maybe being able to support our own family was tough, and not knowing what to do in that sense. But even apart from not knowing, maybe not being able to do certain things. So just to acknowledge that, and also there just around, there's no time limit to grief, and that really came up in the videos as well. Just around, I suppose, maybe a separation if someone isn't directly involved in caring, and they might be a bit removed from that grief, and how do they support their staff and service users as well. So those kind of different comments coming up there, Bethany.
Great, thanks, Aisling. And that first comment you had about, the personal grief, that, people may have been affected by not being able to support their own loved ones during COVID. That's really a very good example of personal grief. And that's as important in the nursing home as professional grief. So again, the same principles apply: being open in work and being able to acknowledge that in work, being able to get support in work around that, and understanding, that around personal grief or professional grief, the help of colleagues, supportive colleagues, and being able to be open. Remember that we had those two things about the loss coping and the restoration coping. Again, what we're aiming for in nursing home workplaces, and in any workplace, this is not just nursing homes, is an openness, a healthy openness to grieving as being an important part of staff well-being, and being able to engage in conversations, to be able to, again, those 3 steps: acknowledge if it's personal grief that I'm dealing with, if I'm worried about not being able to support people in my own family, to acknowledge that, to validate my feelings around that. And those could be feelings of regret, sadness, difficulty, frustration. These are the nice ones. There's a few more that go in there as well, but it's being able to acknowledge those, to validate them, and to be supported by my colleagues around that. Really, really important. And the thing here is, if we can support each other and support our staff, we'll be able to give a better service to our residents, to their families. And let's remember as well that residents also grieve and grieve during COVID-19. They know what's going on. You don't go into a nursing home and see numerous seats at the table becoming vacant and new people coming in. You know what's going on. And residents are grieving as well. So again, the same principles there. It's keeping the conversation open, not avoiding it, and allowing for the different feelings that come up, allowing that it's not a quick and easy fix. And grieving is about learning to live with our losses in a healthy way. That's the kind of thing that we're trying to aim at.
Thanks, Breffney. Yeah, I think that
Great.
covered all the comments there.
Lovely. Okay, I'll sign off now. Thank you very much, everyone.
Thanks so much, Breffney. And we'll hand over to Sarah McCormick now, who is going to deliver the next part of this morning's session. Thanks so much, Sarah.
Thank you very much, Aisling, and good afternoon to all of you. We have touched past 12 o'clock at this time, so it's a good afternoon to each and every one of you. And I want to first of all say that I'm absolutely delighted to have the opportunity to come and thank Aisling and Roisin for inviting me here, because while working in staff health and wellbeing, and while my role here is in relation to, and I will talk about our personal health and staff health and wellbeing, the biggest challenge that I see every day is that while we have got many resources, it's actually getting them known to our staff, and our staff can be able to avail of them. So Breffney has spoken there very eloquently in relation to bereavement and what bereavement does to our life. But we know that our life is full of those things that just we cannot control, let it be disappointments or joys or whatever. So everything that I'm going to be talking about today is not just about in the event of bereavement. It actually is about in looking and saying, how do we get the best out of life if we actually go through that? And Breffney referred there about very much in relation to the workplace. And we know as working, and I'm really delighted that today in our audience is our staff here. Last week, we would talk to the managers in relation to your settings. But we know that work is very important to us. We spend over a third of our lives in work. And if we are not happy in our workplace, it has a significant impact in relation to our health. And many of us knows that it's through our work that we can actually make lifelong friends. We share ideas, we share different activities with them. So our work is not separate from our lives. And in that, it's important as well in actually thinking that when we come into our work, we're also bringing with us what our outside life is. So if we have struggles and if we have joys and if we have all of those outside of our lives, they all form part of our life as we're coming into work. So work and life is all united together. And the more we can actually have them joined in that well-being perspective, the better that they are for us. So I'm going to just share some slides with you now, and hopefully all the technology will work and it will share. Would it be sharing?
Not just yet, Sarah. No.
Yes. Well, okay. Say to cloud. Okay. Share. Why is that? Oh, not coming up as share. Okay. Again, share. It's coming up as save to cloud. I might actually, Aisling, maybe this time I have to get you to.
Yeah, no problem.
I just sent them on to you this morning. If you can.
Yep, I'll open them up now.
Sorry about that now. You'll see. Okay. Just won't share. But anyway, while Aisling is getting up the slide presentation, it wouldn't share there. Would it be sharing now, Aisling?
No, I think mine might be sharing now.
Is that it?
Yes, it's sharing. It's
Okay.
sharing. We can see
Okay,
it.
perfect.
Yeah.
So I think, is it yours that's sharing there? So if you go to the slide view, that should work for us.
If you go to full screen, Aisling, yeah. Great.
Yeah, so we can move on from that. So pardon me, I'll give the signal to you. So I suppose the second slide that I have there is actually just reminding ourselves that our health is our well-being. Are you able to move that on, Aisling? Yeah, that's fine. So yeah, so just in relation to that, it's just reminding ourselves, and it's all the time there, that our health is the best asset that we actually have linked in with our lives. And really, sometimes we take it very much for granted and we don't actually think enough about what we can do. So one of the things is just reminding ourselves there, we sometimes know enough about our health and very much about our physical health. And we are very much inclined maybe to look at maybe different enhancements or things to help us in relation to our physical health. But very, very much we struggle in relation to knowing what from our mental health. And we only get the well-being out of life when our physical health and our mental health come together, because it's that unit together that actually gives us that zip and that enjoyment in life, that extra buzz that we get, and that we get the fulfillment out of life. So a question there, and everything I'm talking about us here this morning, is we thinking, and I'm going to say selfishly, this session is about ourselves. So how healthy are you? So if we ask ourselves, how healthy am I? So what age am I? Where do I fit in? How healthy am I? Do I feel that I'm actually, in that fitness level? Do I feel that I'm getting the best out? Or, and I'm not going to, because the time is against us in relation to it, but in the chat and actually saying, it's a good question for ourselves in actually saying, how healthy do we feel we are? Because most of the time, and in our Healthy Ireland survey across the population, people say to us they want to improve their health and well-being. And one thing I just want to refer there is that there is a never increasing rate of what is categorised there as chronic diseases. So and you hear, we'll just go back a piece there, Aisling. So we hear that we actually say from diabetes, cardiovascular, people say to me, why now are there more people that actually require stents? Why is this happening continually? Why are the people with diabetes, cancer and mental health? And that is growing and growing increasingly across our population and across the world. So there is the question there, how can we improve our health and well-being? What can we actually do? And one of the key messages that I want us to take home from here is that there is avoidance of all of those chronic disease, diabetes, cardiovascular, cancer and mental health. And a very much avoidance of that and preventing them rests within ourselves. Now, that's a very strong statement. And that is a big burden on each and every one of us, because this is all the evidence that is actually showing in relation to them. And I'm going to say there is no silver bullet in relation to this. These are things that I'm putting up on the slide here and actually talking about how do they make that difference. So if we move on to the next slide, Aisling. So the things that are affecting our lives is smoking, alcohol, healthy eating and active living, well-being and mental health. And in that is that the well-being there is social connectivity. And you heard that, and that came more and more to the fore in relation to COVID, and stress. And one of the big modern day triggers that's really impacting our health is stress, and driving cardiovascular disease, driving all of those chronic diseases that's into it. And one of the key things that's there is that our attitude and our management of sleep. And you will notice now that sleep has come more and more to the fore in relation to knowing. So everybody that is now talking in all of those areas is now described as lifestyle medicine. And in that lifestyle medicine, in saying that we can constantly be going to the GPs, we can constantly be looking for interventions, but these are the areas we need to focus on. And if we look at any of the ones that's there, like some people say, oh, Sarah, have we information there on the menopause? What can we actually do? These are the key ones again in relation to if we're in that stage of life and we're trying to manage menopause, what we eat, our exercise, our sleep, and how we're actually able to do it. And indeed, our sleep can be very much impacted as you go through the menopause in relation to those. If you look at dementia, the things that are coming out now in relation to dementia and brain health are exactly those ones. So these are the ones which is difficult and challenging for us to manage in our lives, but these are the ones that are the real key factors to actually help us to live our lives. But one of the key things here is that the lifestyle behaviours is modern society is driving the increasing rate of this. So it's driving us in relation to smoking. Okay, we've done good work in relation to smoking. 29% now is what smokes across the population. But we're now challenged in relation to e-cigarettes and whatever. So when I'm looking at this, you're thinking of yourself and looking at your work colleagues across in relation to all of those areas. And this is what I'm going to talk about is in those areas, what resources and how are we actually helping in a workplace to try to keep our staff and try to help our staff to be able to manage them in the best way possible. So Aisling, we'll go to the next slide. So the first take-home message, and I think that Breffney was referring it to, never forget that you're self first. So you're no benefit to anybody else without that. So when we talk about those risk factors and we talk about resources here this morning, think of it from yourself. And this is about putting your own oxygen mask on first. And this is the piece of saying, well, okay, what can I do in relation to my health and well-being and help me to be more resilient? And, very often people say to me as well, Sarah, why is it that others in the workplace cope better with this than I do. And it's actually understanding how we build a resilience, because we're all individual and we're all different, and we all need to know ourselves and be able to protect ourselves. So next slide, Ashley. So I just wanted to refer there is that the Healthy Ireland framework, and you will see Healthy Ireland, you see it on the TV, you see it on many different ads that's there. And this is what Healthy Ireland is about. It's about us as individuals getting to know ourselves, getting to know what actually helps us to build our health and well-being, and be able to support that through government initiatives across the country at large, to the population, and then as well in relation to the workplaces. So next slide. I just put this slide up here for you, and I just referred to it for the managers earlier on last week, because it's important for us to actually know that in our workplace now, we now have a mix of what's called generations. So the workforce, and you might maybe see in relation to agency staff coming in, you can actually maybe have people that are maybe near the retiring age, and while you can actually have people that are at the beginning of their careers. And it's important to actually understand that, because what is evidently very, very clear is that the different generations that we fit into, it's different, and our outlook on life, our approach to life, the way we manage things is very, very different. And just giving you an example of that is that if you have young, and if I don't know who's on this call, but if you're more in that younger generation, you are probably very much more digital savvy, digital natives than the previous generation, than even my own generation that's in there. But one of the things that you actually need from managers, and maybe a senior manager like myself in here, is you actually need more support and recognition in relation to the work that you actually do, and reassurance that you're actually fitting into that. So it's important that we actually all support. So this is the message here: know ourselves and know each other, because this is why we act differently in our workplace. Next slide. So now I'm going to talk about some resources that are here, and it's just examples because we don't have time to actually go through all of them. So just examples that are there. And this is the first one that I put up here, which is really important, is about minding your well-being. And I cannot emphasize the importance of actually knowing this, because this is about, in this course, and it is available. It's done in 5 video, lovely programs that's available online. You can watch them at any time, any place, whatever. You can watch them on your own, or you could bring a group of people, group of staff members together, or your manager might bring you and say, look, let's take a few minutes to look at those together in it. There's a lovely handbook that goes with it, all freely available. And it doesn't matter whether you're nursing home, private or public, whatever, they are available. And I'll be giving you the link afterwards to helppromotion.ie, and I will be encouraging all of us to get there, because there are the things here about practicing self-care, and that's, we don't have time to go into all of these here, but that is really important, understanding our thoughts. And that's key, and you referred to some of that there in talk about bereavement, because we have to manage those negative thoughts, and some of us can actually be more prone to actually having negative thoughts than positive thoughts. You know, where we sometimes refer to people as being, oh, that's a glass half full, or somebody might say, well, that's Sarah McCormick, she's a glass that's overflowing in relation to that. But it is the piece of actually saying, how do we actually manage ourselves, and how do we take those negative thoughts and replace them with positive thoughts? And there are actions and little things that we can actually do in relation to that. And there's a lovely one there described as about holding and keeping a gratitude journal. So when you go home from work, and go home, and after you're finished, before, put your head down on the bed at night, or before that, just actually thinking of 3 things that actually I am grateful for today. Now, it may be actually a very, very challenging day, but you don't look at the negatives, you look at the positives. You pick out 3 positives, no matter how bad they are. Well, at least I was able to get up out of bed, at least I was able to go to work, and at least, in worst case scenario, I'm alive, right, in relation to. But you get 3 positives, and that takes you away from a negative, or going to sleep at night and having negative thoughts turning around in your head in relation to those. And I refer to their sleep, because the important thing is there is that when you're going to bed, you actually have got quality sleep, and the duration of sleep that actually comes into that. Exploring your emotions, really important in understanding your emotions within yourself. What is it that pushes your button? You know, there's something that, well, that just jarred off me. I don't really know, but when Roisin said that to me, bang, you know, here it is. So understanding our emotions, understanding our trigger points, understanding how we can actually manage them. And really important is there about building positive relationships. You know, they refer to people as that some people can drain us and some people can lift us. And it's important in a workplace, you will get all of those, but it's actually very important in saying, if you have people that actually drain you, well, you need to manage that as well, and manage that in your setting and be able to put those in. And all of this is leading then to improving your resilience, because then your resilience is what actually gives you that strength to be able to bear all the challenges that come to you in life. And that's what actually helps us in a different way of being able to deal with those. And there's a lovely saying there that actually says, is the tree that actually survives is not the one that's actually sheltered away from the wind and the rain, but the one that's out in the middle of the forest and actually gets all of those, because it builds its resilience and helps it to actually go forward. So I'm really encouraging and emphasizing that to you, to take the time and discuss that back in your workplace when you go back. Next slide, please. The next one to share with you then is about stress control. And I mentioned there is stress is increasing at an enormous rate. And stress is something we cannot avoid because it's in all parts of life, but we actually need to know how we can actually control it. And I think that's the line that I really like. Take control with stress control. So we control stress, and we actually use that stress as a positive to be able to help us within our life. And stress affects our digestion. Stress affects our sleep. Stress affects everything that's to do in relation to our life. It affects in relation to our mental thinking. And when I look back there at the other slide, when we're talking about minding your well-being, there's lovely thoughts and lovely programs in there as well that helps you about actually, you know, attention-based meditation, that helps you to actually be able to get your mind to come down and be focused so that you don't have all of those thoughts racing around. And we in the HSE, we run out there that stress control program at various times, various months. I think it'll be running again in September, free of charge to everybody. It's a 90-minute session. It is recorded, and you can actually go back and look at it. And there are a whole lot of different sections in it, so you can dip in and dip out of that as you go along to it. So that's another one to put in your box, your toolkit, as you're actually building yourself from there. Next slide. The next one I put up here is about physical activity, because physical activity, and this is not about running the marathon or the cycle or whatever else, this is about, as they say, getting 30 minutes of exercise each day into our life. And if you can get that more out in the open air, the better for yourself. And that 30 minutes exercise is about actually getting to a state that you're kind of breathless when you're going. So that if you're walking, do a good type of a rapid walk, that you kind of get that in and maybe a piece back down. And that's something that they describe physical activity as the miracle drug, because it affects everything. Our mental health, it affects our weight, it affects everything around our life. So if you actually take that into your life, it is amazing how it improves. And many managers have said to me at senior level that they would not have survived in relation to what happened during COVID. And many staff have said if they didn't include physical activity, let it be walking, cycling, whatever, a jog, it actually helped them because it helped them to clear their head. So build that into your toolkit as well. And the other one is that it's freely available on there to everybody, private, public nursing homes and everybody there. We have online Pilates, yoga, strength and conditioning classes, and chair yoga for beginners. All that is beginners. We will be moving on to do courses for intermediate, and we'll be building those. So they're available, and you can use them if you want to, say, bring them up on a screen in your workplace or whatever, do them as a group or do them at home yourself or whatever. So there's loads in that. We run an annual Steps to Health Challenge. That's the whole idea, to encourage people to get out and walk together, talk and walk and share, because that social connectivity is so important. Looking there at Salinas Launch, you're getting roots around your area of work. So that's freely available there to the Irish Hospice Foundation, as well as maybe getting walking routes, and people do that. The other one I want to remind you as well, sedentary behaviour, sitting. Now, many of you that I'm talking to here today probably say, I'd love a 5 minutes to sit down, because you're running and running and running from one room to another. But if you happen to be somebody that is in a type of a life that is sedentary, but not to forget that when you go home at night, and when we do slog out there in front of couch, sit down there in relation to what we call our couch potatoes, in front of the television, we need to keep ourselves getting up and down, because sedentary behaviour is the new smoking. It is an absolute killer, and it has that link in relation to chronic disease. And the other ones is helping ourselves all the time. Take the stairs, avoid the lifts and whatever. Next slide. Healthy eating. So you hear plenty about in relation to healthy eating. So the evidence is all there about what's in our gut affects our brain. So sometimes in relation to that, we're actually talking about irritable bowel syndrome and different problems we have in relation to our digestion, etc. But that's all being driven, a lot can be driven through to stress, and in relation to how we eat and what we eat. So the pieces there. Eating should become part of a social gathering that's in it, and what we're actually putting in. So if we have vending machines, there is a vending machine policy that's there to help people, and food in our canteens, and look about what's our snacking, and looking about our social breaks. So thinking about that, and maybe staff talking together about how they can improve access for eating in the workplace. Next slide. Tobacco. So of course, tobacco is the worst thing. Smoking is one of the worst things we can do. We know that we have staff that smoke, and here it is all about helping. First of all, do we smoke? If we do, what can I do, and where can I get help to stop smoking? And it's never too late to stop smoking, and it makes a huge difference on our lives. So encouraging ourselves, avail of the information that's there, avail of the supports and many free resources that are available, and also help colleagues. Never be afraid to have that uncomfortable conversation and help a colleague to stop smoking. Next slide. Alcohol. Now this is one, and this can actually be the elephant in the room, and this is one that we don't like talking about. One that we certainly, there's two areas I think that people don't like talking about, is being overweight. You know, if somebody said to me, God, Sarah, you're looking well, you must have lost weight or whatever, well, I'd be thrilled. But if somebody said to me, Sarah, did you put on weight recently? Ha, I don't know, Roisin, if I take that as a compliment from you. But it's really important in relation to saying, how do we actually, you know, look at these things and have a comfort around them. Now, one is alcohol, and in those areas during COVID, intake of alcohol and unhealthy eating and those really rose. So sometimes we actually don't realise what alcohol is doing to our lives, or in relation to our habit of alcohol. And we have seen it in relation to, you know, where we're stressed, we go home, we actually take our snacks, we sit down on the couch, maybe watch Netflix, maybe have 1 or 2 glasses of wine. Before we know it, the bottle could be gone. And then we have to go to bed, we can't sleep, lack of quality sleep, and we have to be up at 6:30 and be on the ward at 7 or 7:30 in the morning. So good key things and good disciplines in relation to looking at no alcohol during my working week, whatever. And there's wonderful resources there on that website in relation to looking about even measuring. And I invite everybody, go on and look at your alcohol and just say, what's my habits? What am I doing? And what can I learn out of it? And know our measures in relation to alcohol. So that is good, and never walk away from it, because it is important. And alcohol has significant links in relation to poor health, and a huge link now in relation to cancers as well. And for us women, it's linked with breast cancer is actually being reported out there as well. Next slide. So other areas I'm talking about in your workplace, and this is about we as staff together, and this is what happens in many different workplaces that I see, staff coming together and doing things. Workplace choirs, and there are supports available there for workplace choirs. Healthy meeting guidelines, that's good from there. Arts and Health Bereavement Project with the Irish Hospice Foundations. That's something we're actually doing, and you will hear more about it, of where we're actually going to produce something, and I'm using the word something because it's not yet defined. The consultation is taking place to the hospital friendly networks and COL in relation to this. But in October, something will be launched there. There will be a support for staff. It might be just something in your pocket, something on your phone, something to remind you, something that will really be coming from an artist's perspective, from a bereavement perspective there. We hold ongoing webinars, and this is what I want to get available to all of the nursing homes, is that we send out the links, but we want to ensure that you get that because we make those available. There are recordings of ones, and I just put those two on here because they're really interesting to listen to. Positive psychology and happiness, and identifying your strengths to improve your well-being. Because one of the things you ask yourself is, am I in the right job? Am I in the right fit for my job? Because if your job and yourself is grating against each other, it doesn't work very well for your health and well-being. Annual Christmas choir, Christmas concert is what we actually run. So we run the Christmas concert there each year, and we encourage people to put in their choirs and be participating in that. And we want to get more and more involvement from you. We do have Healthy Ireland merchandise, so happy to work with you in that if you're running events or whatever, we have merchandise, t-shirts and beanies and things like that that we can make available in relation to HSC settings and HSC nursing homes. Resources available on promotion.ie, so that is helppromotion.ie. These resources are available. Next slide, Aisling. So popular initiatives are looking at people love garden seats outside in garden settings. They love to get out, in particular in relation to outdoor spaces during COVID and post-COVID. Quiet places, people love to actually have that piece of quiet, get away from the razzmatazz. Looking at bike racks and bike shelters so that they can actually cycle to work and have that out and get their physical activity in. And social clubs, so from a social club perspective in establishing those. Okay, next slide. And I'm just referring to this one here is the Know Your Numbers. I would hope that every one of you as staff have that card, and if you haven't, I would be encouraging that everyone, so that can be available, and maybe talk to your managers in relation to supplies of those can be made available to nursing homes. And I am talking to Roisin and Aisling there about maybe putting together some packs that will go out to all of the nursing homes, and that these be in it, because this is really valuable information of how you can look after your own health and well-being. Next slide. So these are just links that are there. So healthpromotion.ie, you as an individual or as a manager or anybody can go on there, and there are oceans of good health guides and handbooks and resources that are there to help you with your health and well-being. And I just put the other two links there because there's a lot of different information and resources available. Might that be the end of it, Aisling? Yeah, and just to say that sometimes people say, but how do CHOs, how do we in nursing homes link in with the HSE? We link in is that, just to say, in every community healthcare organisation, there is a head of service for health and wellbeing, the same as there is a head of service for older persons or for primary care. There is a head of service for health and wellbeing, and in that they have a health promotion and improvement team, so that's where I want you to establish good, strong links in relation to those, so that if you're doing things and want to do things, that is your link across in relation to staff health and wellbeing, and they will be delighted to talk to you and to give you advice and maybe look at how you might get a program in place in relation to your staff in nursing home. But just to take it away, it's for yourselves, and also the fact is that a lot in what we can do ourselves for our own health, but the coming together of staff together is really very powerful, and you can now stop sharing. But like I see it across many different settings in the HSE, staff come up with their own ideas, and staff have great outings and different things, and that's what gets the connectivity, and that's what gets the health and wellbeing. Okay, I will finish with that, and thank you, and over to you, Aisling.
Thank you so much, Sarah. That was brilliant, and just so many resources available to people. What we will do is we'll send out the information to you afterwards, because I know there was a lot of links mentioned there as well. So I'll make sure to include both the links that Breffney referenced and the links that you referenced, Sarah. So yes, just to say thank you to everyone for staying on board this morning with us, and really hope that you did get something out of the webinar this morning. And as Sarah said, we're going into the afternoon now, so it's this morning and this afternoon. And just to thank Sarah and Breffney again for your huge contribution, and it's been really worthwhile. Thank you to Roisin and Jackie as well for the support on this. And Roisin, do you want to come in there? Is there anything that you'd like to say?
Well, no, just to thank the presenters for coming to work with us and be part of a team, and I do hope that it's useful to our audience, but I know that it is, based on the chats and the various things that have come up. I notice as well there are some things in the chats, and as Sarah said, we probably will do a pack and follow up on that, but we will look at the chat box for the two seminars. There are a couple of things we know that are kind of, if you like, outside the remit of this webinar, and we'll find a way, if we can at all, to follow up on those elsewhere. It'll be done through the CRT forum, and people will link back that way. So just to thank everybody again for your work.
Can I just say, sorry, Roisin, can I just say, is that just to say that we're constantly developing resources, and I definitely am interested in your feedback, because I recognise that this setting to the nursing homes really counts this. So I really appreciate your feedback. We're currently working on the development and look to see about a mindfulness and a meditation program that's there as well at national level in relation to those, and we will be running out more webinars, and I will be looking at our distribution list with Roisin to make sure that we've got contacts to ensure that it goes to every nursing home. I believe it does, but I want to make sure that it will. So thanks, Roisin.
Yeah, and I think too, if we do something, you know, as you say, the health and wellbeing head of service is the link in the local area, you know, just to tap into that resource that's there, which is particularly focused, if you like, on this agenda on staff wellbeing and support for people, and to work with the head of service for older persons who would be doing, you know, the day-to-day care and what's required in the nursing units and nursing homes, but also for people who are being cared for at home from a staff point of view, to link into health and wellbeing. So we will try and advance all of that. Now we've kind of come together and made connections, and it's about growing those, and I think that'll be both important and valuable to people, you know, because there's no point having the resources if people can't access them and know where they are. So, and we'll keep a feedback loop on that. So thanks everybody, take care of yourself, thanks for all the hard work, and you know where we are if you need us. All the best.
Bye.
Thanks everyone. Okay, have a good day everyone. Thank you. Bye now.
Bye bye.